To determine the pulse rate, use your index and middle fingers to feel your pulse. Once you have found your pulse, count the beats felt per a minute. Or for an easier and faster way, count the beats for 15 seconds and multiply by 4 to obtain heart rate or pulse rate. There are 9 sites in the body where pulse is most easily palpated. But in this return demo, I used 5 sites, and they are the superficial temporal artery located at the temples near the eyes, the common carotid artery in the neck, brachial artery of the elbow, radial artery located at the wrist, and the dorsalis pedis artery of the foot. I measured the pulse of all sites for 1 minute, and the results are as follows. The superficial temporal artery with 80 beats per minute, the common carotid artery with 92 beats per minute, the radial artery with 92 beats per minute, the brachial artery with 84 beats per minute, and the dorsalis pedis artery with 82 beats per minute. All pulse rate results were within the normal range of 60 to 100 beats per minute. Before starting, make sure that the patient is sitting with legs not crossing and arm at heart level. The first step in determining the blood pressure is to locate or palpate the brachial artery in the elbow. Once located, take the cuff and place it 1 to 2 inches above the artery. The artery should be between the 2 tubes of the cuff, going to the pump and the gauge. Then estimate the possible systolic pressure. While palpating the artery, inflate the cuff until the pulse is no longer felt. The estimated systolic is 100 mm mercury. Add 30 to the estimated systolic to prevent auscultatory or silent gap if present. Deflate the cuff before measuring the actual blood pressure. Take your stethoscope and place the diaphragm to the artery or in between the 2 tubes. Inflate cuff to 130. As the arrow falls, listen to the first beat, which is the systolic, and the last beat, which is the diastolic. Take note of the points where these 2 sounds are heard at the gauge. The blood pressure is 110/60, which is a normal blood pressure.